Is ALP important for diagnosing Paget's disease? When it comes to diagnosing Paget's disease, a common question arises. How important is alkaline phosphatase, often abbreviated as ALP? To answer this, we need to explore the role of ALP in the context of Paget's disease and other bone conditions. ALP is an enzyme produced by bone-forming cells known as osteoblasts. In Paget's disease, the activity of these cells is heightened, leading to increased levels of ALP in the bloodstream. Elevated ALP levels often indicate that there is increased bone turnover, which is a hallmark of active Paget's disease. However, it is essential to note that ALP alone cannot definitively diagnose Paget's disease. Some individuals with Paget's disease may have normal ALP levels, particularly in cases where the disease is localized to a single bone. Additionally, elevated ALP levels can occur due to other conditions, such as liver disease or other bone disorders. This means that while ALP is a useful initial screening tool, it must be interpreted carefully. The diagnostic process typically begins with a simple blood test that measures total serum ALP. If the levels are elevated, this raises suspicion for Paget's disease, but further investigation is needed. To clarify the source of elevated ALP, healthcare providers often perform liver function tests. If ALP levels are normal but there is still a strong clinical suspicion of Paget's disease, more specific bone markers may be measured. Imaging studies play a crucial role in confirming the diagnosis. X-rays can reveal characteristic changes in the bones affected by Paget's disease, such as enlargement and abnormal lesions. Bone scintigraphy, or bone scans, can help identify the extent and activity of the disease by highlighting areas of increased bone turnover. These imaging techniques complement ALP testing, providing a more comprehensive view of the patient's condition. ALP levels are also valuable for monitoring treatment response. Successful treatment typically leads to a reduction in ALP levels toward normal, indicating that the disease is being managed effectively. From the perspective of osteoporosis, it is interesting to note that while Paget's disease and osteoporosis both involve changes in bone metabolism, they are distinct conditions. Osteoporosis primarily involves a loss of bone density, while Paget's disease is characterized by disorganized bone remodeling with increased turnover. This distinction highlights the importance of ALP as a more prominent marker in diagnosing Paget's disease compared to osteoporosis. In summary, ALP is an important marker in diagnosing and managing Paget's disease, but it should not be viewed in isolation. It must be considered alongside clinical findings and imaging studies to ensure an accurate diagnosis. If you suspect you have Paget's disease or have concerns about bone health, it is always best to consult with a healthcare professional for personalized advice and guidance.